want to share with you a 5-minute guide to cognitive behavioral therapy. You know, many patients and therapists and different people would refer to cognitive behavioral therapy as CBT. And it's a quicker form of, you know, psychological treatment, and a growing body of research is showing that it works. One of the reasons why I started getting into cognitive behavioral therapy studies is because, as a health and wellness practitioner and someone who had to overcome my own challenges and struggles, I found that it wasn't just about nutrition and naturopathic medicine, but it was also about the mind. It was also about the psychology of food, you know, mood, and a whole lot of ways that we think affects our healing journey. And this led me to really dive deep. So I just wanted to share some quick tips with you, and I hope that it helps you to really see how it can help to manage your thinking, your feelings, your actions. All right? So let's dive in. One of the main benefits of CBT is that it trains you to be your own therapist. And that's what I like. Really, that's why I went into this field of study. You can learn to change your thinking and develop more effective ways of coping. So, in your sessions, you'll really identify distorted thought patterns. You'll be able to replace them with more realistic one. And as your thinking begins to change, your feeling becomes more manageable and your action becomes more constructive. So there are some people, and I used to feel this way many years ago, like, would I ever change? Would change really ever happen? Yes, it can happen. All right, but you just got to commit. And this is why I really love incorporating CBT in the work that I do. You see, working with a therapist or trying CBT on your own can help you to lead a happier and a more successful life. Studying this quick guide will really give you some insight as well. So I encourage you to go further, do some research, get some more information on this. And of course, if you want to book a one-on-one call with me, and I'll be happy to help you, give you some guide and all of that. Another thing is click the link below or above if you want to really follow my channel, get more insights. I do this because I love the progress, the breakthrough that I've experienced, and I want to share it with anyone who listen so that they can catapult and ignite their own, change and transformation. So let's jump in. The benefits of CBT. One, you can use it to treat depression and anxiety. CBT can be used to treat many mental disorders. That includes some of the most common conditions like depression, anxiety, bipolar disorders, and PTSD, right? So that's one of the things that, you can really learn to incorporate in your life and really start seeing some results. Two, it can help you to overcome addictions for people recovering. I'm working with the Scrumwire Coaching Academy, and the thing is, I get to work with people that are very, very, some of them are on, some of them on addicts, some are, going through all different kind of challenges, marital challenges, facing trauma, all of that. And I find personally that having been trained in cognitive behavioral therapy, it really helps me to take the word of God and incorporate it together with CPT to help people get results. So you can use that therapy to help build up self-esteem and support healthier lifestyle. All right. A third one, you won't believe this one, but cognitive behavioral therapy can help you with sleep disorders. Like, a lot of people depend on medications, but the therapy can address root causes of insomnia and with little risk, and dangerous side effects. We know a lot of medicines have all types of side effects. And think about if you can really start practicing CBT and getting deep into the why you're not sleeping, you can get some results. All right. Another one is it can help to strengthen relationships. Transforming your thinking changes the way you interact with others. You can enhance your communication skills and become more assertive. So this field, I find it to be so amazing. Another one is, and this one I love, 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 anyone who knows me knows, cognitive behavioral therapy can help you to achieve your goals. You may be wondering if you have, a diagnosed mental disorder, and that's why you need CBT. No, 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 my friend. In reality, it's a helpful tool for personal development. Even if you feel like you're stuck and your life is not really on track, you want to get on track, you can use these principles to help you relax and live more focused and more mindfully. So let me share with you a little bit about how you can use cognitive behavioral therapy. One, you can choose the option of finding a therapist. There's a wide range of professionals that practice CBT, including nurses, general practitioners. Sometimes if you go to your doctor, you may be able to, get some info, make some inquiries, and see where that would lead you. If you want to work with like a psychotherapist, you can ask your doctor for a referral or contact, for the psychological association in your state. If you're in a state, if you're outside another region, you can really get a check to see. And, there's this taboo, especially among Caribbean folk and persons, from third world countries, there's this taboo that mental health is something to be ashamed of. If someone has a problem with their digestive system, are they not going to see a gastroenterologist? If someone has a problem with their skin, are they not going to see a dermatologist? With the thyroid, are they not going to see an endocrinologist? So I'm saying if you have a problem like anxiety, depression, PTSD, ADHD, any type of thing, don't you want to see someone? Because you want to make sure your mind is well and your body is well. And the both of them are very connected. So I would say there's no shame in pursuing healing. Just want to put that there. All right. You want to prepare for your appointment. CBT focus on the present, and that's what I love. But your therapist will need some history. They would need to know, relevant medical conditions, your childhood experiences. So start thinking about your priority issues and what you want to accomplish when you're going to that session, because that's really going to help. All right. Another thing I will advise, you want to do your homework, because if you're going to see a therapist, that therapist will give you assignments to do between sessions. So you may have to do some writing and journaling, practicing new responses to situations that you find challenging. So it's really a practical approach. And I love, that whole idea of being practical. You want to use that practical approach to really get the results that you're looking for. Another thing that you may find when you if you choose to see a therapist, is that you will find it's a little bit uncomfortable. So I would say to you, accept the discomfort. You might experience unpleasant emotions at first, but push through, because that can be natural and a constructive part of facing your fears, facing your doubts, and really getting ahead. Some people, you would prefer to like read a book. That's a good one as well. If you want to try CBT on your own, maybe you don't have access to a therapist, or you just want to get, the initial information, you just want to kind of like expose your mind to this a bit, I would say browse for books recommended by trusted sources. One would be like the Association for Behavioral and Cognitive Therapies. So look for books that you can use, and you can gain a lot of knowledge there. I remember, I think it was my old bishop would say, if you read 10 books on any topic, you become a master. So really, there's advantage in getting that knowledge. Knowledge is power. Let me give you some other tips as well. You can take an active role, for your progress will depend on how much effort you put in, right? So collaborate with your therapist in setting goals. That's if you're using a therapist. Be honest and open in talking about your thoughts and your feelings. All right, so be very active in seeking to get the results that you need. I would say also try to avoid shortcuts, because CBT sounds so straightforward. You might be tempted to think, I know this already, I understand this. And you would really find that as you depend on taking a structured approach and applying the knowledge consistently, it is really going to take a bit of time to adapt to this new way of thinking, this whole new methodology, right? So I encourage you to be patient. There's a difference between quick and there's a difference between instant. So yes, this is like a quick guide, but you're not just going to jump to instant. You want to really dive in, understand, and really follow through by, getting the knowledge consistently if you feel that, you need to focus on having better mental health, overcoming some fears or anxiety or anything that is affecting you. Because guess what? There's something called the gut-brain axis. And whatever is happening in the gut, it affects the brain. And what is ever happening in the brain, it starts affecting the gut. So if you want to be healthy, you have to have a healthy mind and a healthy body. So be patient and give yourself that new habit that you're developing, give yourself time to reinforce those new habits and keep practicing it. and you're going to feel, more in control and more at peace. So I want to say to you again, my friend, work on it until it becomes comfortable and automatic. Review your progress as well, on the other hand. And if you're working with a therapist, let them know when you feel stuck. And if you feel like it's easier to talk to someone else and you may benefit from that approach, you can also find, different practitioners. There are coaches like myself that practice cognitive behavioral therapy combined with other treatments as well. I use a combination of CBT, naturopathic medicine, and nutrition. And I find, that holistic approach, you get a lot of results. So psychotherapy may be difficult, you know, um, as well as it may be affordable and accessible for some. But with CBT, you can make quick progress, and the strategies can really help you because you can use them at home, or you can work with that therapist, as I said before, to schedule, you know, those tailored, you know, schedule things and get it more tailored to your needs, your personal needs. So, my friend, that's a quick guide to cognitive behavioral therapy. And I hope that it gave you some insight and will help you. Healthy mind, healthy body, life on purpose. God bless you.